This technique that I'm going to demonstrate for you is for the knee. This is a general taping technique that can be used for various different conditions, including osteoarthritis, general knee soreness, patellofemoral conditions or Osgood-Schlatters. It may also be used to actually give the knee some feedback for proprioception purposes as well. For this technique we'll use the 5 centimetre width. You could also use a 10 centimetre and split the tape as well, but for this one I'll show you with the 5 centimetre. So we're taping over the knee. You'll need to have your patient in knee flexion so that the area that we're taping is on as much stretch as possible. So if they're able to comfortably sit on the edge of the bed, that's probably the easiest way to be taping. You'll need to measure from 1/3 of the way down their thigh to 1/3 of the way down their shin, so that you can cover over the whole knee, and you'll need 2 strips of tape. So we'll just cut those lengths together to save a little bit of time. You'll need to round the edges, the corners of the tape, to ensure that it doesn't catch on any clothing on both ends. And then we're going to apply the tape starting from the bottom, working our way up. So you'll need the first 5 centimetres placed over the centre part of the shin, basically where their knobbly part of their shin bone is, so we're covering that. First 5 centimetres is just placed onto the surface of the skin without stretch, but you're then able to peel the backing paper off to the last 5 centimetres, so you've got this nice and free to immobilise the tape around the knee. So you're actually going around the kneecap, over the top of the quad, and placing the tape down onto the inside part of the quad without any stretch over that particular area. We'll then use our second strip to do exactly the same, but over the medial aspect of the knee, so the inside part. You'll need to place the second strip next to your original strip, again making sure the first part has no stretch. The last 5 centimetres is held on with the backing paper, and we're going around the kneecap, up and around the quad, placing the last part of the tape down, just ensuring there's no little bumps, and giving it a good rub so that it's nicely stuck to the knee. Now obviously this can be used for multiple different conditions. In particular, this is a great one for osteoarthritis. Most patients usually like to have a little extra bit of compression either over their kneecap if we're correcting any patellar glide issues, or underneath the kneecap for other growth related injuries, or often for osteoarthritis underneath the kneecap is really comfortable for the patient as well. So we'll measure a strip across here. Again, rounding our edges, folding the tape in half so that the backing paper can be torn, and this particular strip where we're going directly underneath the base of the kneecap, applying the tape with firm pressure underneath the kneecap, with one strip coming up around the inside part of the knee just being placed down, and then the other strip over the lateral outside part of the knee doing exactly the same thing. So you can see we've got a nice coverage around the kneecap, giving the whole patellofemoral joint lots and lots of support. Now if we actually get the patient to straighten their knee or actually stand up, you'll see the bunching of the skin around the kneecap where we get this drawing, lifting effect of the skin and soft tissue around that area.